rotate your phone. You can't turn your phone while recording. No, I like this. Okay, good. Hey, Barry, say hey.
Hello, Dr. Goodman.
Yeah, it does say we're live. So, welcome.
So we're actually on Facebook now.
Supposedly, yes. So I am at Fairhaven Community. I talked to Dr. Ginsburg today, Barry Ginsburg. He's a dermatologist. And he told me that that he was going to talk to y'all about skin. And I said, well, could I come and do a Facebook Live here where we talk about skin? And Barry was gracious enough to include me in this. And so I just want to thank y'all for having me as well today. And so, Barry, you're a dermatologist. Obviously, you specialize in skin. And since we're in what I'll say an elderly community, what would be some of the skin issues that this population should be most concerned about?
We got two ways to do this. I can say some things, or you can tell me what you're most concerned about. Ask me, what is your biggest concern when it comes to your skin? Anybody want to blurt it out, or you want me to just...
I prefer them to ask you rather than me. I hate to be the interviewer.
Ask me something.
Anybody?
I, as a young woman, abused my body and skin to the sun because in those days they never said anything about the sun being so terrible. How can I now make myself aware? Of course, I don't go out in the sun a lot. I use sunscreen. But what should I be looking for before I have to come to your office?
Well, I think you bring up a couple of points that are important. Number one is, what can I do to, prevent future damage? And that's obviously, we don't want to spend our lives indoors. So we want to be able to go out in the sun. So one of the biggest questions people ask is, what does SPF mean? I want to use a sunscreen when I go out. What number should I use? And in general, if you have already been diagnosed with a skin cancer, then you want to use the highest number you can find. And I generally recommend 70 or above. The less sun you get, the better. But you also have to realize that if you're not getting out in the sun, you need to supplement your vitamin D. So that goes a little bit hand in hand, but that's a separate subject. So even a 15 protection factor blocks about 92% of the sun. A 70 blocks maybe 98%. So for most people, that little difference is not going to be much. But if you're very fair and have had a lot of sun, every little bit counts. So I generally recommend the higher the better. Always wear a hat. They say avoid midday sun, but that's, we go out when we can go out. But I think that's the most important thing, is to prevent further damage, block the sun. When I play golf, I wear a wide brim hat. I make half my living on men's ears. So men have to wear a wide brim hat. And I also wear long sleeves, not only because I want to protect my skin from skin cancer, but the sun also causes the skin on your arms to be very thin. How many have bruises on their arms? I mean, me too. So, and that's not only because our skin gets thin as we age, but that's the sun. So I'm doing it. I've never had a skin cancer. I've been careful. So I'm doing it more so I won't get more sun damage and bruise more easily, but you know how it is.
What type of cancer are we talking about? Are we talking about melanoma? Are we talking about basal cell or squamous cell? What is the specific skin cancer?
The skin cancer that is most directly tied to the sun is squamous cell carcinoma. The second is basal cell carcinoma. Both of those are skin cancers that we call locally aggressive, but rarely metastasize.
So they rarely spread.
Excuse me. Yes, exactly. But they could be very damaging if you don't remove them. They can, if they're near the eye, they can invade the eye, the nose. So we have to treat them. But as long as we manage them locally, it's not going to spread, and you're not going to die. Melanoma is also aggravated or somewhat caused by the sun, but there's not as much direct relationship. If you've had a melanoma, then you got to be careful. Melanoma is more a genetic problem and also related to the number of moles that you have. So we tend to see melanoma in a younger population and particularly in someone who has a family history of melanoma, or parents of multiple moles, and they have multiple moles. There is a kind of melanoma that occurs on sun-damaged skin in elderly people, and that appears as a big brown spot. And it's the most common thing I see in my office is elderly people who come in with these brown warty growths. I'm sure I could probably go around the room and find some. Just the brown raised crusty spots, a lot of them on the back, sometimes on the arm, sometimes on the face.
And what is that?
That's called the seborrheic keratosis. I jokingly say God made seborrheic keratoses so you'd come to my office to get them checked and I'd find your skin cancers because they're benign. But they look bad, they can look black, they can look awful, but they're not.
So they asked you to speak louder, and I have a loud voice. So he mentioned seborrheic keratosis, which are those.
There's a brown to black warty growths that literally can appear anywhere, but they're not sun-related, and we don't know what causes them. They just happen. Generally, they don't cause symptoms, but they can be itchy. But like I said, I think that God created them so you'd get your skin checked so I could find your skin cancers.
Are there any more questions out there for Dr. Ginsburg?
Dry skin.
Dry skin is whatever, I'd say half of the elderly population that I see complains of itchy or dry skin. And there is no magical dry skin. I can't cure your dry skin any more than I can stop your hair from growing. Dry skin is the skin does not hold moisture like it should. So the only way to combat dry skin is to increase the relative humidity around you, which if you're indoors most of the time is a vaporizer or humidifier. Moisturizers trap moisture. They don't provide moisture. So you dampen your skin, you put on your moisturizer after your bath or shower, and then you moisturize your skin. Is there a best moisturizer? The best, they have to be creamy. The thicker the better. Vaseline is generally not cosmetically acceptable, but it would be fine if you moisten your skin with Vaseline on it. I'm not a big fan, but they have CeraVe. We have several different moisturizers in the office. Paying $100 is no better than paying $6 at Walmart.
What about just skin creams in general? Can you hawk a particular brand or not?
Not really. The only product that has ever proven to improve the color, texture, and tone of your skin is the old acne cream called Retin-A. And I generally recommend that to almost anybody. If I get someone who comes in at a young age, my daughter's been using this since she's a teenager, and she's 38 now. It can actually reverse sun damage. It improves color, texture, and tone of your skin. It's available by prescription, but we sell it in the office for a quarter of the price that they can sell it in the
So
pharmacy.
are you telling me you don't sell skin creams in your office?
We do
Barry?
sell skin creams in my office.
Okay,
and we
so
sell
you
expensive.
do. So how do you decide what skin cream you're going to sell?
I don't. Usually, patients who come in know what they want. They want Clinique, or I'm trying to think of what are some of the high-end brands that we sell. Fedamir. They're more elegant. They may go on smoother. They may feel better, and some people who money is no object. They want the finest thing that they read in the magazines, and they're great products. But are they better than? Are they going to make your skin healthier than the other products? No.
Well, is there a skin cream that would make your skin look better?
Retin-A.
Just Retin-A. That's
Retin-A. Also, the alpha hydroxy acid preparations. We sell glycolic acid. You can buy a lactic acid product over the counter, Lachydrin, and that's another good dry skin product. But in general, the alpha hydroxy acids and the Retin-A are the only ones that have really shown anti-aging effects.
Are y'all interested in anti-aging? So Wrinkles, there you go.
I recommended retinoic acid, which is that is more of a pharmaceutical than a skin cream. I don't particularly recommend one brand. CeraVe, Eucerin, Kerry lotion is what many of you probably grew up on, is as fine as any. So it really isn't the best, but it's how to use it and when to use it that I think is important.
So,
To use it, you gotta use it.
so Wrinkles. Can I go over here? Do you mind?
No, I don't mind.
Okay, great.
Look as bad one day.
Let's see.
They're on everyone.
You want to get rid of wrinkles?
I'd love to.
So have you tried Botox?
No.
No.
Tell me about Botox. Why do you go no?
I just don't care to be getting injections, that's all.
Okay, that's
I've
reasonable.
been a nurse too long, I guess.
I guess when it comes to treating aging skin, when should you begin and when should you stop? You should begin whenever you have something that bothers you enough. If you're young and the treatment is incredibly safe, then the only issue is financial. And some people have money to burn and some people don't. So you want to get what gives you the most bang for your buck. As you get older, we literally have injectables that will treat anything from frown lines to crow's feet to, we have injectables that you can get rid of this. We have injectables that can reinflate the face. Literally, when you think of why, what's happening down here? Why I got these big jowls? The reason is not specifically gravity. Obviously, gravity is only one direction things can go. But if you look at Julie's face and Holly's face, you see a very beautiful, firm, full, I call it a balloon. Okay? As we get older, it deflates. We lose bone and we lose fat. And I jokingly say we lose fat where we want it and we gain it where we don't. But that's good for my business. But anyway, so we literally have products to reinflate the face. If you look at a picture of yourself, I think you showed me 30, 40, 50 years ago, your cheekbones were bigger, your jaw was bigger. So we have products that can do that. So the only decision becomes desire and finances.
And injection. Those
And
are all
injection.
injections.
Yeah, that's all
There's
injections.
nothing non-inject. Is there anything non-injectable for wrinkles?
Not that's Retin-A, but you have light laser treatments. We can do lasers that have essentially no downtime and they're painless. The deeper you go, the more improvement you get, but the more downtime you have. So we have very low intensity lasers that you can do for little brown spots and fine lines, upper lip lines. I think the things people hate the most is this and this. Yeah.
Yeah, but you can't really do Botox there.
No, Botox doesn't work there. Botox is a muscle paralyzer. But being a poison, it's one of the safest medications we use. Because the dosages that we use it in medicine, you could not accidentally overdose someone. There is not enough medication in a whole vial of Botox to hurt someone. So you'd have to accidentally draw up 10 syringes out of 10 bottles to hurt someone. Dr. Goodman uses Botox for muscle spasms and torticollis and all these kinds of things. And actually, after he did my treatment, we injected Botox into the muscle in my back, which was still like a knot.
You did that.
I did that. She did that. I couldn't reach around that with his permission.
Yeah.
But anytime you have a knotty muscle, see, this frown is caused by a muscle. See, when you make a frown, it's the muscle that makes the frown. So and these muscles don't serve any other useful purpose. So if you weaken these muscles, you can't frown. And what's amazing about Botox, and this is absolutely true, there have been double-blind studies, Botox improves your mood. Because if you can't frown, your brain knows you're not frowning.
Oh,
and it
come
makes you,
on.
I promise
There's been
you,
double-blind studies.
I promise you.
Talk to me, please.
Absolutely guarantee you.
So people have had fake Botox injected into them. And
I
they're
guarantee
thinking,
you, there are studies
I
that prove.
don't buy that one. I don't buy that one.
He's going to do a literature search. Botox for depression. And it's almost or as effective as some antidepressants. That's besides the point. That's not why I
I'm
do
just
it.
having fun.
But Botox for headaches. We inject Botox in the forehead for people who have migraine headaches. And why does it work? Believe it or not, we don't even know. But when we started doing Botox, people would come back for the next treatment and say, you know what, I haven't had a headache since my last treatment 3 months ago, 4 months ago. So the company did the studies and showed that it worked, and we still don't even know why. But it probably has something to do with, it feels like you got a strap around your head. Yeah, literally, we really don't know why Botox cures migraines, but it's actually one of the approved indications for Botox is treating migraine headaches. And neurologists do that for people with frequent migraines.
Anybody else with questions?
I have a question. Tell me about hair loss.
That's the other thing I was going to say. Unfortunately, we all lose hair as we get older. Everybody's hair thins. So there's really 3 kinds of hair loss that's most common. There is the aging hair loss, which everybody's going to experience. There is androgenetic alopecia. If your dad or mom, it's not one side or the other, or both are bald, there's a much greater chance of your hair thinning tremendously as you get older. Men tend to get receding hairlines, bald spots up there. Women tend to get diffuse hair loss. That's, and that is actually somewhat treatable if you start early, because it's androgen dependent. So we treat with a very mild water pill called spironolactone. Some of you may be on it for your blood pressure. But what it does is it blocks the hormones that cause hereditary hair loss. So that's 2. The other is what we call a fancy word, big word, telogen effluvium. I can't even say it.
Say it again.
Telogen effluvium. Effluvium, I think, sort of means like the fall, like the trees sort of effluviate, I don't know, effluviate or something like that. But anyway, telogen is the resting stage of the hair. There are certain medications, like beta blockers, who many people are on, that can cause hair loss. Any severe illness, if you've had surgery, or in the hospital, if you've lost 50, 60, 70 pounds, you may lose hair because of that. So that's the third kind. And those are generally the ones that have a rapid onset. They'll come in and they go like this, and you get 10 or 15 hairs. Everybody's going to have a couple hairs come out when they do that a little bit, but if you're losing 10 or 15 hairs, then something active is going on, and it can be investigated. Yeah. Skin conditions of the scalp generally don't cause hair loss unless they're incredibly severe. Scalp abuse can cause hair loss if it starts at a very young age. Very, very tight braiding, frequent chemical treatments can cause hair loss. Teasing is more if you're pulling and teasing, but just teasing
I know
the hair
the word
can cause,
for that one.
What's that?
Trichotillomania.
That's right. Well, no, that's what people pull their hair
Yeah.
out. Yeah. And it's really it's a disease like nail biting or something like that. It can be very, very serious. But I think that's one of the most common problems I see, particularly men always know why their hair is coming out. And I think those other causes are more common in women, and I don't know why. Either men don't recognize it but if you start treating hair loss, at a young age, the hereditary type, now there are actually approved medications for it. There's Propecia, which was approved years ago for hair loss. I've been taking one of those drugs now over 20 years. And my hair has not thinned a lot. I don't know what it would have been had I not been taking it, but my brother has very little hair. He definitely has a different heredity package, but I am almost certain one of the reasons my hair has not turned grayer or thinner is because I take those.
What do you take?
I actually take, it's called dutasteride. There's 2 medications for hair loss. Finasteride, which is a prostate medication, and dutasteride, which is right now it's only a prostate medication. It will eventually be approved for hair loss, but it's very effective for men. If you start a 22-year-old who starts to recede, you start them out at that age, they will either never reach what the stage they would have been, or it will take much longer for their hair to thin. So if you had children or grandchildren who have inherited hair loss, there is a way to start them at a young age and prevent the progression.
How are your brother's joints?
Oh, God. I've had 2 hip replacements, 2 cervical fusions, 2 back surgeries, and I have seronegative rheumatoid arthritis. My brother has had 2 knee replacements, 2 hip replacements, 2 shoulder replacements, and back surgery.
So he is a good control.
For the joints.
And he has no hair.
But he has no hair. It's a different gene. It's a different. But I played mostly tennis, so my damage was on my joints. He was also a baseball pitcher, so a lot of his damage in his shoulders came from throwing a baseball. But it's definitely genetic. My mom wasn't too bad. I'm surprised. She had a hip replacement, but everybody at some point will need a hip replacement, whether they actually get it or not. You're going to get arthritis when you get older. So if you live long enough,
I have one more topic for you that these folks may be interested in. They may not be. But it affects both of us in terms of what we see in our practice, and that would be shingles. Maybe you could mention, talk to them about shingles to them.
How many have gotten the new shingles vaccine? Shingrix, not Zostavax. Shingrix. Make an appointment.
Original shot, but not, is there a booster?
Yeah, you got to get the Shingrix twice. No, there is no booster for Zostrix, but there is a booster. I got my first one, and I'm due for my second.
Are you going to have to back up? Even I'm confused.
Okay, let me start again. Shingles is a devastating disease. How many have had shingles? I mean, no one wants to get it again. I had such severe pain, and I didn't even have any blisters. And right before he stuck the needle in, he says, "You sure you don't have shingles?" I said, "No, I don't got shingles." He did a block. You remember that?
No, I don't.
He did. He actually asked me that, and which would have been a good treatment
But
for him
that's
anyway.
funny. I'm asking the dermatologist if he has shingles.
And I didn't have blisters, so I couldn't. You can't say you have shingles. I had so many joint problems that I thought it was my hip, my knee, whatever. So ended up getting shingles, breaking out in blisters after. But now, so you don't want to get shingles. So everybody should be vaccinated, and you can get it. I think all insurance pays for it, and you can get it all you do is go down the street to the pharmacy. They may have it here, and you want the 2-part Shingrix vaccine, and it's done, I think 3 months apart or something, or 4 months apart. But that's very, very effective in preventing shingles. What?
How often do you have to have it?
I don't think they know yet, but probably once, if you do both boosters, I don't know, it's 5 or 10 years. It's a new vaccine, so I don't think they've come out with the guidelines yet. And if you've had shingles, it's sort of a vaccine, so you probably won't get shingles again for 5 years or longer. But it's an excellent idea to get the shingles vaccine. Shingrix is what it's called, but all you got to do is go to the pharmacy and say, "I want the new shingles vaccine." And they know what it is. It's a 2-part, and it should be covered by insurance.
Well, I'm getting bald.
What? You're getting bald, I know. I'm getting thin too.
I'm going to stop it there.
Okay.
Barry, I
That's some
appreciate you taking the time.
Okay.
Thank you all for allowing me to come in here and interrupt your program or be part of your program. And
I'll film him doing one.
yeah, that would be
next month.
fun. We'll come back and Barry will film me. That would be fun. I would like that.
We'll try to set up something monthly. Like I said, I got some good people to entertain you and different doctors who, you got to put in your little request list. What you would like to hear, entertainment-wise and doctor-wise. I got a very close friend who I play golf with all the time. My wife's an attorney. My best friends are attorneys. My daughter's an attorney. My sister's son's an attorney. So if there's any legal things, Katie is a Crimsonette, James's girlfriend, and the ceiling might be high enough to get one of them to do some trolling for you.
Fun.
I don't know if I'd take out a chandelier, but yes.
Nerves in any way.
It only affects the nerve of the area that's affected.